Hello, I'm Nick the nurse. Today we're going to be talking about some of the legal and ethical aspects of mental health nursing. In this particular case, we're going to be talking about something called intentional torts, and even more specifically, we're going to be talking about battery. Now, I'm not a lawyer and I can't give legal advice, so that's just my little disclaimer here. But we need to review the fact that battery is defined as an intentional, harmful, or offensive touching of another without consent or privilege. This can also be a crime, but for this particular case, we're going to be talking about it as a tort or a civil wrong. Now, an example of of battery is maybe somebody goes up to you and boom, punches you in the face. It's a harmful or offensive touching of another, me in this case, without my consent, or you didn't have a privilege. Okay. In the mental health setting, one of the ways that battery can come up is by giving somebody medication without consent. For example, if a patient is with it and they don't have any legal cause for it, the nurse goes ahead and gives maybe a patient who's acting unruly some Ativan, or they give the patient some Haldol in order to get them to kind of calm down for the benefit of the nurse. And this is important to note because it's okay sometimes to give a patient Haldol or Ativan or Seroquel when they need to help a patient because they might be a threat to themselves or to others. But when it's done for the convenience of the nurse, or because the nurse is a member of a very short-staffed unit for that particular night, there is no reason and there is no excuse for a nurse giving a patient medication in order just to shut them up. And this is something that comes up quite a bit. If you watch Dateline or 2020, you see in quite a few nursing homes. Nursing home staff will often sedate their patients in order not to deal with them. Now, of course, that's the exception rather than the rule, but it does happen. Believe it or not, there are some nurses out there who will do that. And on top of that, it's something that's very frequently tested on the NCLEX, because the NCLEX wants to ensure that you don't go out and unnecessarily hurt your patients by committing a battery. So when you're studying for your NCLEX or your nursing school exams, remember to understand that battery, again, which is the unauthorized, harmful, or offensive touching of another, which is intentional without consent or privilege, and you'll know everything you need to know about battery for the NCLEX. Best of luck and see you next time.